My name is Hilary Payne, and I'm a registered dietitian and certified diabetes educator with the Blood Tribe Department of Health out on the Kainai Nation. So we do a little bit of work in diabetes management, as well as kind of targeting nutrition concerns across the lifespan. I think one of the biggest challenges is just like the lack of resources. So being able to connect people and give them the education that they need and the services that they need. It's really easy to kind of look at diabetes as like this is what you have to do and follow the letter of the law, but most of the time our treatment plans and things that we do with clients is going to depend basically what works for them in their environment or what works for that specific person. So everyone's going to have a little bit different plan that they have to navigate or things that they have to do differently than others. So ODVCC's Virtual Care Clinic is a team of certified diabetes educators and an endocrinologist that work really closely with our clients. And so they are able to provide direct and specific diabetes management or diabetes treatment to clients living in their own communities. So clients don't have to travel, they don't have to even leave their homes. They can receive that care virtually inside their homes where they're comfortable, when works for them, and it's kind of just a really great program to be able to support clients that are moving from community to community or maybe don't have those services in their community. And so it's been kind of a really great way for those people that don't necessarily have resources near them to be able to access diabetes care. The Diabetes Virtual Care Clinic has made a huge impact on my clients. I've had a handful of them I've sent recently, and just kind of the way that they're able to access resources from the diabetes educators, but then also the endocrinologist as well. So it makes it kind of like I don't want to say one-stop shop because it's multiple appointments and things like that. But for the most part, they're able to kind of get all of their diabetes care through one clinic instead of having to bounce around, have different appointments, have different people trying to all connect. Their clinic's wrapped around. So their endocrinologist is going to talk to their staff, which is a pretty unique thing as well. The other nice thing about their clinic is that those diabetes educators, they just do diabetes work. So that is their main focus. That is their main education. That is what they do all day, every day. And so they're just kind of like a very good expert in their field. So they're able to help those clients out to kind of a further extent than sometimes I feel my skills maybe can sometimes go, because I do so many different roles with my position, but they're able to kind of just target that diabetes, have that conversation with the endocrinologist, and it makes a really good wraparound service for those clients that access their services. One of the nicest parts of the clinic itself is just the fact that there is an endocrinologist. So we don't have very many, especially in the South Zone where Kainai and Blood Tribe are. And so it really limits who actually has access to an endocrinologist. And if we are able to get our clients in, sometimes the wait list can be like months to years to see that endocrinologist. And so being able to refer them to ODVCC's clinic, know that they're not only going to see an endocrinologist, but a bunch of diabetes educators as well, is something that's been a huge benefit to our clients. They're able to, nothing against the family doctors in our community, they're fantastic and they do their best, but when you have an expert in diabetes management running their care, they're getting the best type of care they can. And so that's been such a weight off my shoulders that I'm not panicking about oh, should we be looking at med adjustments, or should we be doing this, or should we be focusing on this? When we send our clients to ODVCC, I know that it's going to be covered and they're going to be the most well taken care of that they can be, for sure. They also have a really great education platform, so they're always running courses for us as educators or for training things, and so that's been a very beneficial thing for me as an educator in our community to be able to be part of their study groups with their clinic, or to reach out to their staff if I have a question about a client. They're always willing to answer my absurd, out of the blue, weird questions that might come up with clients. I have a couple clients that are younger, so they're 18 to 25. They're living, in some of these remote areas on the reserve. They don't have access to a vehicle all the time. And so sometimes, I have one client that they've been on my case list or my roster for almost 5 years, and I've only ever seen them once. So it's really hard to get them into clinic. And for me, I find it very difficult to keep them on follow-up virtually. It just was a kind of a struggle. I had so many other things on the go that sometimes, if they didn't answer the phone, I wasn't able to try again right away or to call back right away. Whereas ODVCC's Virtual Care Clinic, they're able to kind of continuously reach out. That is their role. And so having that virtual component has allowed that client more access to services. They don't have to go anywhere. They can stay at the comfort of their own home. And I think that that's the age range where I've really seen the biggest benefit is for those clients like 18 to 25 that really love the virtual kind of setup. They don't have to leave. They can answer it on their phone. They're very competent in doing Zoom. Like those are the clients that I've seen like the biggest benefit for sure.